how are you going to give topical medications? On the skin. Yes, anything that you give on the skin is called what? Topical. It can be ointments, okay, lozenges, all of these are topical. And also anything that you are giving in the eye. Okay, so anything that you are giving by into the ears, anything that you are giving into the eyes, it's a nice sound, yes?
Yes.
So,
Relaxing.
some of them were like
Relaxing
to
sound.
dance. Huh? Okay, all of this is what we call what? Topical. Okay, skin, eyes, ears, nose, all of these are what? Topical. Okay, they have their own other names like ophthalmic. When we say ophthalmic, you give it into the eyes. When you give otic medications, you give it to the ears. When you give it nasal, you give it to the nose. Okay? Okay, that is enteral means anything that you are taking by
Swallowing.
mouth, you swallow it. Okay, that is called enteral. Then parenteral means anything that gets into the body, like intradermal, intramuscular, okay, subcutaneous. Okay, all of these are what? And intraarterial and intrathecal, or even intraosseous. Okay, so intravenous means you give into what?
Vein.
Into the veins. When you give medications into the veins, it's called intravenous. When you give into the arteries, do you give medications into the arteries? Yes,
Yes.
some medications. Okay, into the artery, that's intraarterial. Intraosseous, when you give into the bones.
Bones.
Okay, you prick the bone and you give some medication or infusion into the bone. Intramuscular, into the muscles. Intradermal, into the skin. There is one that is not mentioned here, it's called intrathecal. Intrathecal, usually you go into the spine. You know the spines? Yeah, into the spine, and when you give it there, it's called intrathecal administration. Like, can you see intrathecal pump, for example? You give medications into the okay, so there are different medications that you give them intrathecally into the spine. So, all prescriptions should have what? What does all prescriptions should have? Prescriptions, they should have what?
Patient's name.
Yeah, patient's name. Like a prescription is like this. Can you see
Signature.
the name of the patient,
Date.
the signature of the doctor here, the date and time given here. Okay, and if you have a refill or anything, refill, yes, 6 times here. And this one, for example, Lipitor, 10 milligram tabs. How many? 30.
30.
So what do you do? Signature, okay, tab, 1 every day. That means 10 milligram. First, you have to take Lipitor of 10 milligram, yes? So 1 tablet every day for how long? For a month.
Amen.
Yes, so you have 30 tablets here. Okay, so this is called a prescription. That is, so all these informations are here. Okay, especially when you are giving parenteral administration, there are some rights of medication. You know that? Rights of medication. That means when you give a medication, always you should have what? The right patient. Okay. The right what? Route. The right what? Medication. Right dose. Right time. The right to refuse. And right documentation. These are some seven rights of medications. So how many times should you check the medication, whether it's the correct medication or not? 3 times, yes? 3 times. Check medications 3 times. When you take out from the cabinet. 2, when you prepare the medication. 3, before you give the patient the medication. Hmm?